Play therapists. This little video that I've put together is really just me offering a couple key tips to help you navigate emotional flooding when it happens in the playroom. I think this topic is a topic that we need to continue to have a conversation about. It's not something that's talked about very much in our field, and yet it is such a real part of the play therapist experience. So let me first start off with just talking about what I mean when I say emotional flooding. So really emotional flooding can be defined as it's too much. Whatever it is, it's registering in your system as too much. So the child is saying something, they're doing something, whatever it is, it's too much. And this happens also for the child. The child also can experience emotional flooding, but the tips here are really for you to navigate your own nervous system when you're experiencing the too much in the playroom. So as we know, when we are in a play experience with a child, the child is really asking us to really join them in their emotional world. So the way that I like to talk about this in metaphor is they're asking you in a sense to join them in the river. So the river of their emotions. And sometimes the current can pick up. Sometimes things start to speed up. Sometimes there's an intensity that starts to kick in. And that doesn't just mean that the play is becoming hyper aroused. That just means it's intense. Whatever's happening starts to get slightly outside of your window of tolerance or is starting to move towards the end of your window of tolerance. Maybe they're playing in a particular way that's challenging for you. Maybe they're saying something that's challenging. Maybe what they're working on is challenging because it has a reminder of something that is you're working on in your life or something from your past. Whatever it is, emotional flooding is on the horizon. So when we emotionally flood, it's a bit like we're in the river with them, but we're not in the boat with them. So what we really want to do from a metaphor standpoint is be in the boat with the child while the boat is heading downstream. And with both you and the child in the boat, that's really the metaphor again is it's inside your window of tolerance. You're in it, but you're also not in it. You're in the boat. And when we have emotionally flooded folks, we have fallen out of the boat. We are officially heading downstream in the river, which it's really hard to be able to navigate the experience with the child from a therapeutic lens when we are down the river instead of in the boat. So these tips are really tips to help you stay in the boat if we're going to keep going along with that metaphor, or the neuroscience language is to help you stay within your window of tolerance or right at the edge of your own window of tolerance. So the two main tips that I want to focus on, the first one I call 1 foot in and 1 foot out. So when we're playing with a child, as the child is playing or as they're telling stories, we naturally become activated in our own nervous system. We're naturally going to feel some level of arousal inside of ourselves. And it is absolutely key that we learn how to work with this level of arousal. We need to, for attunement purposes, we need to be able to feel it. So that means I have to be willing to be in the river. Okay, I have to be willing to be in the river. I have to be willing to feel the sadness, to feel the anxiety, to feel the overwhelm. Because if I don't, I can't attune to the child. But I simultaneously have to know that this is a play therapy session and that I'm actually not getting hurt and that it's actually a puppet coming at me, not a real shark, as an example. And so the metaphor, the language I use here is 1 foot in, 1 foot out. So 1 foot in the intensity and 1 foot out in regulation. Or from a nervous system standpoint, we're accessing our ventral vagal response, which is our regulatory response in our system, which allows me to be regulated in the dysregulation. I can still take a breath in the dysregulation. I can remind myself that I'm safe in the dysregulation. I can feel it and not be consumed by it. So I'm in the boat, that's the 1 foot out, while I'm in the river, that's the 1 foot in. So I'll say that again. I'm in the river with the child, we're on the same journey, but I'm also in my boat. I'm regulated. My head is above water. I can still steer if I need to steer. I can look ahead. I can see the bigger picture. I can still see the banks on the side of the river. When I emotionally flood, the boat has capsized and I am now downstream and I just can't hold. I'm not the container at that point. I'm not able to be the external regulator, is the language that we would use in synergetic play therapy. So that's the first tip. What do you need to do to become, how do we want to say this, to be able to access your own ventral state? What do you need to do to have one foot in, one foot out? Remind yourself, this is just a play therapy session. Remind yourself that you are actually not under attack. Remind yourself, connect with yourself, breathe, engage in some type of a mindfulness practice in the moment to help you stay connected here. All right, the second tip that I'm going to give you is that when we start to play with children, we also oftentimes go into tunnel vision, where we become hyper focused on them and hyper focused on the play. Zoom out, look around, engage your prefrontal cortex, look up, look where the door is, look where the window is, check the time. If you can practice being in it and then not in it, again, it's still that thing of one foot in, one foot out, of expanding out, looking around, that will also help you so that you don't become consumed by the emotionality of what's happening in the room. Now, there are many more tips that I can give you. Many are mentioned in my book, Aggression in Play Therapy, and I also teach about them in my courses. But for this little video, those are 2 tips to help you when it starts to come in. Remember, breathe, do what you need to do to access your ventral state. Remind yourself, 1 foot in, 1 foot out. Zoom out, look around, orient yourself so that you aren't so caught up in the emotionality and the intensity of what is happening in the room. And as always, from my heart to yours, wherever you are, whatever you are doing, take care of yourselves, be well. You are so, so, so much the most important toy in that playroom. Take care of yourselves.